Pastors Association at this station.
Your information station. WTIM.
Welcome to the WTIM Morning Show. I'm Avery Cooper. Your stream brought to you by Taylor on TaylorvilleDailyNews.com's Facebook and WTIM TV YouTube. Brought to you by Landmark of Taylorville, where you always do better with Landmark, and People's Bank and Trust, where they put people first. I'm here on the phone with Clinical Assistant Professor Dr. Yusuf El Battar from Pana Community Hospital. He also practices at the teaches at the SIU School of Medicine. Do I have that right, Doctor?
Yes, that is true.
All right. So, tell me a little bit about yourself.
So I'm currently an associate professor at the SIU School of Medicine. I joined in 2015, started practice at the beginning of 2016, and I've been there with the Pana Community Hospital growing along their way since then.
Very nice. So when did you mentioned 2009, right? Was when you started practice?
I started practicing in 2016.
My bigger pardon.
But my training goes back to 2011. So I did a lot of training.
Okay.
So I did medical school and orthopedic surgery in my home country in Lebanon. Moved to the U.S., did 4 fellowships back to back, and then joined SIU as an assistant professor. So this past year, I was able to get promoted to an associate professor, which is a big feat for me for now. That's one of the goals achieved so far. And then I was able to establish orthopedics in outreach communities such as Pana. And that has been a very, very successful story so far for me, and obviously for the hospital as well.
Have you always wanted to be a doctor?
Of course, ever since I was a child, always liked sports. I'm the standard orthopedic surgeon. Basically started with sports, had my own share of injuries, then went to the orthopedic doctor, and he was able to put me back and be able to play soccer again. So this is when my passion grew, and I was able to proceed down that road.
Orthopedic specialty, right? That's something that
Yes.
you seem to focus on. So tell me a little bit about more of your specialty and common conditions you treat.
So I take care of pretty much all orthopedic conditions in the clinic. I focus on some of those areas, a specialty of mine, which are my preferred specialty areas, the shoulder, the hip, and the knee. And these are the most common procedures I do in those regions. Also do the other general orthopedic procedures of the upper extremity, lower extremity, fracture care, back pain, all that, all those conditions.
What does orthopedic mean? Or I guess what do those who have orthopedic specialties focus on specifically? It's bones, if I understand right.
Exactly. Orthopedic surgery is treating bones and joints. It's actually a Latin for actually making a kid straight. So it started with kids having scoliosis, the curvature of their back, of their spine. And then the orthopedic term was coined after that, how to straighten a kid's back. And this is how it progressed over time.
And so now that is what you work on. You help people fix their bones and their joints and everything else that is associated with that.
Absolutely. We call it the musculoskeletal system. We concentrate on the bones and the joints because they give you the stability. And obviously we work on the tendons, the ligaments, the muscles, the nerves, the cartilage, everything that's associated with the musculoskeletal system to help people move around, walk, jump, run, sit, stand, all those daily activities, and obviously the sporting activities as well.
Well, what about your experience at PCH, Pana Community Hospital? Tell me a little bit about some of the procedures you've performed. I know you started seeing patients in 2016, and you were one of the first to perform orthopedic surgery in the new surgical suites in January of 2020. That must have been pretty cool.
That's actually, it was very amazing to be able to witness the birth of the new surgical suites at PCH. We started off in the older surgical suite, and I was the first surgeon that performed orthopedic surgeries in Pana. And we grew that that program there, and now it involves multiple surgeons and multiple specialties. I was the first one to do surgery also at the new suite in 2020. That was a very big achievement on the part of the hospital. Obviously, without their support and obviously the presence of SIU and myself at Pana, that would not have been a possibility.
Well, what are some of the surgical procedures you have performed that stick out to you at Pana Community Hospital?
So I do quite a bit of shoulder arthroscopy, fixing the rotator cuff, fixing the labrum, taking care of the biceps. Took care of multiple knees with arthroscopy instructions, meniscus repairs, cartilage surgery. Did several hip arthroscopies, taking care of the an extra bone in the hip. We call it cam lesion. Did several fracture care of the upper lower extremity, especially the wrist, the fingers, and the ankle. Obviously, the standard procedures like carpal tunnel, cubital tunnel, the one at the elbow, tennis elbow, trigger fingers, ganglion cysts, all these general orthopedic surgery procedures I have done. One case that sticks out is not too long ago, probably the past 2 years ago. There was this gentleman who was really very highly active, was in the end of his 40s, 50s, had an ACL tear. Usually, those people end up having osteoarthritis and needing their knee replaced, which will affect some of their activities. However, we were able to, because the condition of his knee was pretty pristine for a 50-year-old, we were able to reconstruct his ACL and was able to get him back to actually playing golf and sports. That was actually a very nice outcome out of this procedure. And obviously, it just gives a lot of credit to the team I work with and to the company I work with and to the training I've had. So all this plays a role in the successful outcome. And the most important thing is to have a patient that's actually dedicated, that is compliant with the treatment and the post-operative care. And these patients usually get a good outcome.
How important would you say that post-operative care that mostly rests on the patient, mind you, as far as I understand anyway, how much would you say that but weighs on the overall success of the procedure, the post-op care? How important is it?
So in my opinion, we as orthopedic surgeons, personally, I'm just part of the entire team. So I do my part, the surgical part. The post-operative care is a very, very, very important, I cannot stress it enough, very critical part of the success of a procedure. Basically, if you treat a fracture and you want the patient to be immobilized for a few weeks and the patient is not compliant, takes his or her splint off and slips and falls or grabs on something, they might actually undo whatever we did. And that will make the outcome less than ideal and the function of that extremity that's involved less than ideal. So it's very, very important. It goes more on when we say soft tissue surgery. When we say soft tissue, it involves the ACL, the rotator cuff, the meniscus. These are delicate structures. They need to heal. They need the blood supply to heal. If you do a lot of movement in the post-operative period, that is against what we recommend. That will delay the healing and might actually have the surgery fail and the procedure fail. So I cannot stress it enough.
Yeah, absolutely. What days are you seeing patients at Pana Community Hospital?
I currently see patients on Thursdays every week. I have clinic every day. I have surgery days every other week in the morning. And on occasions on Tuesdays as well, I get some surgery time. Surgery time is a little bit at a premium these days. We have a lot of difficulty and a lot of providers that want to access the surgical time in the OR. So it's a bit tight these days. But we can make it work. It's not a problem.
Mm-hmm. What other hospitals or locations do you see patients?
So I take care of patients in Springfield, in Decatur, and in Carlinville Area Hospital as well. These are my other locations,
And of course, Pana Community Hospital.
obviously.
Right. I'm his clinical associate professor, Dr. Yusuf El-Battar, and he specializes in orthopedic medicine. He's here on the WTIM Morning Show, the live stream brought to you by Landmark of Taylorville, where you always do better with Landmark and People's Bank and Trust, where they put people first.
WTIM.
Markets now on the RFD Radio Network. I'm Jim Taylor. Corn mixed, beans slightly higher, wheat trading higher. September corn up 2 3/4, 7.15. December corn 6.94, down 2. March corn down 1 3/4, 6.97 3/4. September beans 15.50 3/4, up a penny. November beans up a penny, 14.89 1/4. January beans 14.94, up 1 3/4. September wheat 8.50, up 8 3/4. December wheat up 13 3/4, 8.72 1/2. October bean meal 436.30, down 3.50. September bean oil 72.44, up 52 cents. In the livestock market, September feeders down 60 cents, 180.92. October live cattle 145.50, down 1/4. October lean hogs 92.45, up 57 cents. In the energy market at this hour, October crude oil 87.62, down 16 cents. Jim Taylor, RFD Radio Network.
This is a station editorial. I'm Randall J. Miller, station president. The word inflation is one we hear practically every day in the news. And of course, both political parties are blaming each other for it. Truth is, no matter where you go or what you buy, you're feeling its effects. I want to delve into the why we have the inflation rate at plus or minus 10% over the past year. It's simple economics, capitalism, and the marketplace. Reason number 1 of 2. When both parties passed legislation borrowing or printing over $2 trillion, that's trillion with a T, dollars to pass out, claiming the country needed it in 2021 despite the signs the economy was doing okay, that's going to cause inflation and a lot of it. Reason number 2 of 2. When politicians shut off the domestic oil spigot because the majority party is realizing that instead of having 4 years to pass their green agenda, they now have less than 3 months, they've got to stop anything that'll increase domestic oil supply and more, begin ramping down anything that burns fossil fuel. The problem is when you shut down increased production of fossil fuels that still power homes, businesses, and factories, you can't ramp up the green agenda to generate power fast enough. Wind and solar aren't being built quick enough to replace the fossil fuels the majority party are shutting down. That's why one of my transmitter side power bills last month went from $1,200 to over $3,100. Ouch. Well, there you have it. Simple economics, capitalism, and the marketplace. And when politicians tamper with it, it turns into a mess and is hitting our pocketbooks and will continue to do so for quite a while. When the marketplace is left alone without any tampering by the government, it works pretty well. When government, whether it's federal or state, does tamper with it, you and I will be paying more for our energy, goods, and services for a long time. That's our opinion. We welcome yours. Our email address is editorial@randyradio.com.
Your information station, WTIM.
Welcome back to the WTIM Morning Show. I'm your host, Avery Cooper. Your stream on TaylorvilleDailyNews.com's Facebook and on WTIM TV YouTube. Brought to you by Landmark of Taylorville, where you always do better with Landmark and People's Bank and Trust, where they put people first. I'm here on the phone with Pana Community Hospital orthopedic specialist and clinical associate professor with SIU, Dr. Yusuf El-Battar. You provided some great insight on what this orthopedic specialty is, doctor. And I want to go over a little bit of some preventative care. So what would you say is a important thing that you can do to prevent orthopedic injuries, whether that's soft tissue or bone or anything else that relates to orthopedics?
So it's very important to keep your body healthy. Of course, it goes without saying. Good nutrition, good exercise, good routine throughout the day. So in the morning, I would wake up, I would do some stretches. If I have some back issues, some knee issues, some hip issues, there are some specific exercises that can be done. We have some of those listed. If you want to check out the American Academy of Orthopedic Surgeons. That's the website I take my information off. That's our academy. They have all those listed there. They're pretty good to actually getting the patients with this, daily ache of the back or the knee that does not need really to, the patient doesn't need to go to the doctor for, maybe it aches a little bit today. Getting some of those exercises, stretches especially, have been proven to actually work in those patients and reduce their chances to going to the doctor. The other treatments that can be done are simple over-the-counter Tylenol, acetaminophen, or any NSAIDs like ibuprofen, Advil, Aleve. Any of those medications are very effective in actually helping with the pains that the patients usually present with. The other things you can do is if you are a manual laborer, you want to protect your back, there are some ways to actually help you lift, push, pull objects while protecting the back, not putting a lot of strain on that back. So you have to have a good core to be able to do those. The other things are, use of computers, your use of cell phones. People tend to develop carpal tunnel on the long run. It's very important to do stretches for the wrists, especially bending the wrist forward, like towards the palm. If you bend it backwards, like holding a mouse, that will actually aggravate the symptoms of a carpal tunnel. Some people use braces at night. Some people take some medicine for that. These are all preventative options on the activity side of things. The other things that can be done are proper diet, obviously, proper diet, 3 meals in the day. Try to stay away from sugars, a lot of carbs, more proteins, anything that will help with the general metabolism of the body. These are some tips to help with the basically musculoskeletal health of the body.
One of the things I heard you talk about there, stretching. I had a question, and it's totally self-serving because I've been wondering this for a long time. Is it best to stretch before or after exercising, or both? Do you have an answer to that?
Yes, I have an answer.
Okay. I wasn't sure if I lost you there for a second. Yeah, is that something?
That's a very good question.
Yeah, okay.
So basically, anytime you want to proceed with any sporting activity, any kind of exercise, it's better to stretch. The muscles are at their resting state when you do not stretch. You want to start immediately having that muscle work for you. The muscle has to just get going. It's like a diesel engine. You need to just stretch a little bit to avoid having bad injuries moving forward, especially hamstrings, quadriceps, hips, ankles, Achilles. These are all injuries that can happen because of lack of stretching. And obviously, when you're done with your sporting activity, stretching is also important, not as important as before. But the more important part is to cool down, actually do some icing. Icing is very important as an anti-inflammatory tool. You can put a bag of ice on the involved area, and that will help you.
Interesting. Well, when your preventative, if not when, but if your preventative methods don't work, you at home, by you, I mean, then obviously that's where Pana Community Hospital come in, and you will provide the services they need from start to end, and especially the end with your rehab services. Briefly tell me about those.
Absolutely. We have a very good facility at Orthopedic Community Hospital. It has the state-of-the-art equipment. There is a pool there. There's a lift inside the pool. People can do water therapy. The team there is absolutely amazing. They take care of my patients. They help out a lot with the post-operative recovery. Plus, I have to give a shout-out to my team, to my nursing team in the clinic, to my nursing team, and anesthesia team in the operating room. Obviously, none of this would happen without them. So I got to give a shout out to those people.
Anything else that you'd like to add, Doctor, before you go?
I'm just thankful for the opportunity to take care for the Pana Community Hospital patients and the surrounding areas. If there's any issues, any questions, you can reach us at the specialty clinic at the Pana Community Hospital.
That's clinical assistant professor at SIU School of Medicine, Dr. Yusuf El-Battar. Thank you so much, Doctor.
Thank you for having me.
WTIM.
The Big 870 WTIM Assumption Taylorville, 96.1 W241 CF Taylorville, 107.5 W298 CD Shelbyville, 107.9 W300 EH Payne and Nokomis.